These are all things you've probably seen before. On the agent page, this is going to be a new page that we're that we've been working with. A bunch of cool stuff on here. O'Neill Marketing News. We're going to have our webinar schedule. Will always be in there. Industry news. We've got a calendar. We got a file sharing, and then a to-do list as well. Over here on the landing page, I've since updated this since the last one of these I did. I think it looks a lot better now. But basically, we're going to be utilizing this as kind of a landing page in order to capture leads and hopefully in the long run get new clients. So people can go right in here, run a free quote. It will go directly to your HealthSherpa account, which we will have set up. What's going on? Yep, there we go. Which my IT guy's working on that still. So he said it will definitely be done by Friday. So we'll have the phone number be clickable, also an email, run a free quote going to your HealthSherpa account, and then also if they plug in anything here, it will go to your email and your email alone. So I think it looks a lot nicer than it did yesterday. But we're slowly making progress on that. So hopefully we'll be good to go here soon with full capabilities, and then good directing to your own HealthSherpa accounts. All right. I can go into more of the functionality of HealthSherpa if that's something that you guys want. One thing I did talk with the guys over at HealthSherpa. They did tell me that today that they will be having another tab here that will basically state if there are additional action items for each client, and you'll be able to sort by that as well. So, if there are documents missing, if there's payments missing, it'll just allow us to be more organized rather than going into each one of your clients, especially if you've got a lot of them. That could be very time consuming, and then you actually have to manually select if there's you've got documents missing, you've got payments missing. It'll just be a lot easier if that's integrated so that it pulls directly from the client's account to let you know if there's still action items that need to be taken care of. Then you can sort by that so you have all of them in a list. So I think that'll be very helpful, will allow us to retain our clients and make sure that they don't fall off because documents weren't in or payments weren't made. Another thing I definitely want to point out is this marketing link. Use this. It's directed for your account, and if anyone clicks on this link and is taken to HealthSherpa and fills anything out, they're going to be saved in your leads. Or if they complete a full application, it will you'll actually get credit for it without having to do any work. So that's great. Another thing we did this a little bit yesterday or earlier today. Basically, if you send these out now, they'll plug in all their information. They'll be able to look at their plans, and when they click enroll, page will come up. They'll say an agent will give you a call after the November 1st deadline. Sorry, I got another call coming in here. Hold on. All right. So utilize that direct link. It's a fantastic tool that is free for everyone to use. So definitely utilize that. on your own, and also, with our help through our landing page. And then if we're going to do marketing, we have marketing dollars to help split the cost of a marketing campaign. If that's something you're interested in, let's make it happen. And this is really where that all starts. Add logos. You can get Google Analytics for Google advertisements, which we're going to do a bunch of this year. And really, a lot of times you're just going to be starting up here in the quote, up in the right corner where it says quote. Another thing I want to point out here, under carriers, make sure you're all set up here. Okay. I've got to add a couple other states. Let me just do Texas while I'm in here. Another thing that just came up is this Humana. I immediately called HealthSherpa and said, what's going on? I also called Humana. Apparently, this is a Medicare supplement under 65. At least that's what Humana said. HealthSherpa has no idea why that's in there. It's also showing up in Texas, so they don't have an under 65 ACA plan. For some reason, it's still showing up there. So if something like that changes, I will let you know for sure. But don't be surprised by that, because it's false. Settings. Make sure everything under FFM account is correct, or at least how you want it. If you're writing through someone else, you're going to have their first name, last name, and NPN, but everything else is going to be yours, including and especially the FFM username. So make sure that what's in here is what should be in here. Make it correct in FFM username. All right, now let's get into the plans. Start in the Tampa Bay area, and I will go down to South Florida next, and then we'll do a couple of the other ones. I'm going to include blue here just because. You can see what is fantastic is that these plans are all right on top of one another as far as price goes. No longer do we just pick the cheapest plan for our client like we've been doing over the past couple years. They are all extremely competitive on price, very close to one another. So we really need to look at number one, network, number two, plan benefits. So I want to just talk about the reasons that I'm really very bullish on Oscar. I think they, as long as the doctors are correct and the network works for your client, I personally think Oscar is hands down the best value at all levels in all counties. And I'll tell you a couple of reasons why. Number one, they have free 24/7 telemedicine. All the other telemedicine companies, they use they either use a third party, and everyone except for Cigna has a copay for telemedicine. Usually, I think with Ambetter is $20. Oscar and Cigna have free telemedicine. Now, Cigna is using a third party app. Oscar is built right into their own app. So really like that. Their tech is just way better than anyone else. Their application is their phone app is fantastic, and I think it blows everyone else on the water as far as a technology standpoint. Okay, so another thing, just still on that technology side, if you go into your Oscar account and you go up here to menu and you scroll down to Oscar demo, this is going to allow you to download a demo account that you can show your clients. So there's a whole bunch of different things that you can do in here. And I think it's well worth someone who's like, curious why we should choose Oscar. I think this is a good selling point and allows them to visualize that right with you as they're deciding what they want to do with their plan. So you're going to have it's got a step tracker. You can get the doctor on call, the teledoc right on the app, concierge and inbox, so any messages coming through. You also have your concierge team, which is something I'll get into in a minute here. Care search, appointment scheduling, that's all available in there. Also, medications, lab results. I believe you can even view like doctor's notes and stuff in here. So it just is a central location to house all of your medical data and everything that's going on with your health. So I think that's fantastic. They do get rewards for step tracking. Maximum of $100 per year, but it's if you get enough steps in, it's a buck a day towards the Amazon gift card. So it's an extra $100 if they do just an average amount of walking, and it's on their app. So this is kind of like a full how-to as far as the demo goes. So I think this is a fantastic tool for selling. So definitely utilize that. I think they also have, maybe they don't have a Spanish version of this. I thought they did. Let's see. Man, I'm popular today. All right. So, really great website, really great app, and then you can demo. It's a demo account, so it's got a bunch of information in there. It's all, fake stuff, but it would give them a good understanding of, without actually having to enroll in the plan in order to get an idea of what it's going to look like when they have it. So, number one, the tech. Number two, telemedicine that's free, and number three is this concierge team. Actually, there's four things. The concierge team, I really think is really the future of medicine, is where we're going to go, and kind of is leading the way in helping us solve some of our issues as far as waste in healthcare costs, and they've been showing tremendous results in that too. It also is a big factor in why Oscar's retention rate is extremely high. When people utilize Oscar and they see the value that they're getting from Oscar that they're not getting from a lot of these other companies, especially someone like Blue, the patients love it and they stick with it forever. So their retention rate is astronomically higher than anyone else out there. And it's because of these personalized touches that they have, having basically all of your care information right on your phone. And then this concierge team acts as an intermediary between the doctor and the patient. So, and it helps advise them on the right things to do to help reduce waste, minimize the client's cost or the patient's cost, minimize overall healthcare costs by reducing waste, and kind of advise and manage how and when they should access care. So a good example of that is someone thinks they need to go to the emergency room. They've got a rash or something like that they're not sure what it is, and they're concerned. They can either get a doctor on the phone and do a screen or a FaceTime type of deal, but they can also call into the concierge team, and they might recommend that they go to urgent care instead of the emergency room. Or they might recommend instead of going to a hospital that they go see a specialist directly, or they make sure that you know maybe all they need to do is go see their primary care physician instead of going to a specialist. So little things like that that save the client a ton of time by doing things the right way the first time, and also a ton of money too, because they're going to get hit if they're going and doing things that are unnecessary. So just the amount of time and money that care coordination can save is pretty tremendous and helps them keep uh, their overall costs down. So um, I really like that. And the fourth reason that I like Oscar above anyone else is they also, on all of their plans, um, and some of the other plans do have something similar to this, but Oscar on all of their plans, their urgent care is always at the same rate. It's covered at in-network level on every one of their plans. So for instance, this is their cheapest bronze plan, $75 copay to go to urgent care. But if you're out of state or anywhere out of network, you can still go to an urgent care facility. It's going to be $75 and that's it. So some of the other carriers have certain plans that do things similar to this, or have co-insurance down here. A lot of times it's subject to the deductible. But Oscar has this on every plan, is that urgent care is covered at the same rate as an in level or in network level. So I really, really like that. So let's take a look at this plan. So this is just their classic bronze, right? Classic bronze plan. Subject to the deductible. The deductible is actually not bad. So a little lower than a lot of the other ones. Out-of-pocket max is standard for a bronze plan here. And then we've got 50% co-insurance on all this stuff. Another great thing about Oscar is they have the lowest copays on generic drugs. $3 copays, and then $7.50 for mail order. So that's great. Pregnancy, this is also another differentiator to a lot of the other plans. While you're subject to the deductible on childbirth and facilities and professional services, office visits, no charge. That's something a lot of the other plans don't have. And then they have children's dental checkup. Let's take a look at And Better and then Bright. All right, And Better. Deductible is the same as the out-of-pocket max. So I think that really goes more towards the Oscar side. Same kind of thing, no charge after deductible because the deductible is out-of-pocket max. Higher, at least they have prescription or generic drug copays. Okay, you can see just like the Oscar, there's no charge after deductible. But you can see right here, urgent care not covered out of network. Pregnant office visits, subject to deductible. Really the only difference here is the Ambetter does not cover dental checkup, but it does cover children's eye needs. Just looking at those, I think the fact that we've got a lower deductible with, push everything else aside, with the tech and the urgent care and the app and concierge team, even just on the basic stuff, copays for generic drugs, and the fact that all of these they've got to meet the out-of-pocket max first before they get anything. At least with Oscar, you've got a lower deductible and then a 50% co-insurance until you hit that out-of-pocket max. So I think from the surface or even down in it, I think Oscar's got the better hand on Ambetter for bronze. Here is Bright, same kind of deal as Ambetter. Deductible is the out-of-pocket max. Oh, one other thing that I want to point about Oscar. I always forget this. With the primary care visit, they're also getting the first 2 non-preventative visits are $50, not subject to the deductible. Okay, again, telemedicine free, but they get the first 2 non-preventative visits at $50 copay. With Bright, you get the first 3 visits at a $40 copay, so a little cheaper on primary care visits than Oscar. But you see all of this 0% co-insurance, it's all gonna, you gotta hit your out-of-pocket max first on all this stuff. Again, urgent care, not covered out of network. Now, the one redeeming quality I think that Bright has is they do a really good job on child needs. Eye exams, glasses, dental, that's all in there. So that is an advantage with Bright, but take that out, and I think it clearly still goes to Oscar. I just really like this Oscar's urgent care out of network because and the copay in network. Because if you are traveling, it's nice to know that you're not your only option is go to the emergency room, and in a lot of cases you're paying full price till your deductible's met. So it's really nice to have the peace of mind that if you're traveling over the holidays or during the summer that you can go to urgent care and you're not gonna rack up huge bills. All right, a couple other things I wanted to point out. I think this was the so Ambetter Balance Care 12. Oh no, we'll get to that in a minute here. Let's see which one of these it was. I think it was this one right here. So it's a little more expensive, $328 as opposed to $311. So $17 more than the cheapest bronze plan. Yeah, I think that's the one. Saver bronze? No, that's not it. No, that's not it. Saver bronze? No. All right, I'm gonna keep going here for a minute. Let's see. Where's the bronze next? Right here. If you can find this plan as a zero premium, I think it's by far the best bronze plan out there. In fact, I think this bronze plan is better than a lot of silver plans out there. Again, because it's Oscar, you get all these other benefits, copays on doctor's visits, and this is really the first time I was doing some research last night. This was really the first plan that we're really seeing a significant savings when there is hospital expenses. So what's cool about this is you've got a lower your deductible is 0. Okay, so you're getting help right off the bat. Okay, deductible is 0 on a bronze plan, right? you've got the typical out-of-pocket max, but what this plan does is because there's no deductible, basically everything is a copay. Okay, so you can see here, and it's just a stop loss. Okay, so yeah, it's relatively high. You've got a $50 copay, you've got $90 specialist visits, but then you've got copays for diagnostics, right? You've got copays for imaging, generic drugs. I mean, this is standard, right? Now, while these are relatively high, 50% coinsurance on the other things, and then you've got just flat rate copays. So it's a stop loss. While these are relatively high, if you do go in the emergency room, if you do have surgery, usually it's going to cost more than $1,000, right? So at least you have a stop loss prior to your deductible or prior to your out-of-pocket max, right? A lot of times these plans are going to say, no charge after the deductible when your deductible is your out-of-pocket max, right? Um, or you've got co-insurance till you meet your out-of-pocket max, and if it's very high, you're going to be paying until you hit that out-of-pocket max. With here, no matter what, you've got a stop loss. Okay, so you're not going to be hitting your out-of-pocket max because you need an ambulance to have outpatient surgery or whatever. Um, Same kind of thing here. Hospital stays. While that's very high, it's significantly under your out-of-pocket max. This is also another one I think is a no-brainer, okay? If you're pregnant, $300 copay for childbirth delivery professional services, facility services, $3,000. None of these other plans, especially not the bronze plans, maybe a little bit on the silver plans and probably on the gold. You can get close to this, potentially beat it, but for the premium, um, in almost all cases with other plans, if you're going to have a baby, you're going to hit your deductible or you're going to hit your out-of-pocket max. You're definitely going to hit your deductible. Here, you're out of pocket $3,300 to have a baby. I think that's very good comparatively. Copays for everything, co-insurance, so it's immediately co-insurance because the deductible is zero. Hospice service, you've got that. All right. So I really like this Oscar Bronze Next plan. That's what it's called. If you, let's see if that ever goes to zero. Let's go to the lowest income. I don't know why all of a sudden blue goes to the top. That's, I don't like that. I don't like that at all. Because that's not accurate. Let's see. Bronze next. Classic bronze plan. So low income. This is gonna be my go-to bronze plan for zero premium if you can get it for zero premium. Classic bronze next. Now, another thing that I want to point out, Molina is going to be the cheapest bronze plan in Orlando and Jacksonville. They're really only going over the bronze market. But even so, this is not a bad plan. This is not a bad plan at all. Even in South Florida and Tampa. Okay, what I like about this, really the differentiator here, is you've got copays for doctor's office visits, and there must be the core care bronze without vision is probably going to be 0. I don't know where it is. Yeah, right here, core bronze, same thing. The one differentiator here, is going to be this: hospice services. If anyone needs hospice services or might need hospice services during the year, Molina is really the best option for them. So if they need that and they're 0 premium, that's great. All right, now let's look at silver. Let me get rid of this. I don't like how once you put a subsidy in there, Florida Blue goes to the top. That's not right. Bright is going to be the cheapest in the Tampa area. Again, I'm going to stress over and over and over, check the network before you put anyone in Bright. I'm very hesitant to be recommending Bright because of the fact that they have no track record in the state of Florida, and their network's not very good. Second, and really the only other state that they've had a decent market share is going to be in Colorado, and that is not even close to as big of an ACA state as somewhere like Florida. So coming into Florida year one, for them as the cheapest plan in a number of counties, in most counties actually, they are going to pull in a ton of business. Okay, and that means they need to be able to scale and not get overwhelmed and not offer poor customer service, and they need to do things the right way. I'm personally not going to take a leap of faith and say, I think they're going to do it right the first time. I need to see a little bit of a track record. I would love, I definitely don't mean to put more competition down. We want more competition in the market. But I personally don't feel comfortable throwing people on Bright when I can't vouch for them. Okay, so next year that might change my tune on that, but I think you know personally I'm going to stay away from Bright until next year. And better, this and better Balance Care 12, almost identical to the and better Balance Care 11, but it's going to be a little cheaper in premium and a little higher on all these other benefits. Okay. What's great though, okay, is we got 413 for Bright and better. Oscars at 427. So we're there within $14 of the 3 plans. Okay, so that's not bad at all. Personally, if we're tight on price, I'm probably going to be pushing people to and better Balance Care 12 if they can't make the jump up to Oscar. I think we're going to sell a lot of and better Balance Care 12 this year, just like we sold a lot of and better Balance Care 11 last year. All right, let's go to South Florida. Let me go to Broward and Palm Beach, and then we'll wrap this up. All right, Broward. Oscar all the way. Okay. Oscar on bronze. It's going to be the cheapest plan. And like we went over before, hands down the best plan out there. You've got Ambetter as well. Again, I'm not hating on Ambetter either. That, just because I really like Oscar doesn't mean I don't like Ambetter. I don't particularly like Bright just because, like I said, it's just they don't have the track record. But I do like Ambetter. I just think there are better benefits with Oscar. So if someone already has Ambetter and they're happy with it, leave them there. There's no hurt in that. But if someone's got Blue, I think Oscar's a great company that we can start pulling people out of Blue and dumping them into Oscar. So again, if someone's happy with Ambetter, I'm not recommending that you switch them. Leave them on Ambetter. That's totally fine. Again, Molina's got that hospice, so that's going to come in clutch. And then silver, Oscar's also the cheapest on the silver. Let me get into these a little bit real quick. It's going to be the same plan design as what we went over before, or in Tampa. So here is the Core Care Bronze Molina. We already went over that. Oscar Saver Silver. Okay. Really the selling point here is a lower out-of-pocket max and a lower deductible. Okay. You're getting help quicker, right? And then it's a 40% plan basically. Again, cheap generics. Urgent care covered at in-network level. This is one of the few plans that there's not a copay on urgent care through Oscar. Almost all of them do have that. But this isn't bad because that deductible is low, that it's, you're going to meet that deductible sooner. Okay, office visit again for pregnancy. And then children's dental. All right, classic silver next plan. So when we like the bronze, classic bronze next, here's the silver version of that. Okay. So what's great about that is the silver is going to modify, right? We've got the cost sharing reduction. If they're getting a subsidy, all of those, well, I guess it's this one. All these will modify. So it'll make it that much better. That's something that, for instance, the bronze does not have, right? That's not going to change your doctor's office visits and your deductible. With the silver, it will. So you'll see there are a few different things, like things will be subject to the deductible because in many cases the deductible will be much lower. So again, you're going to have copays for basic stuff a little lower or cheaper than the bronze copays. Diagnostic testing about half of what the bronze test or copays were. Subject to coinsurance. This had a copay for the bronze. It is subject to coinsurance. For some reason, generic drugs skyrocket on. Oh, this is Ambetter. That's why. That's not right. What threw me off there? Here we go. Sorry about that. Actually, let's look at Ambetter first while we've got it. They do have a low deductible. Okay. Copays, things that were not available on the bronze. We got more bronze, more copays. Generic drugs, that's their standard rates. $40 and $50 coinsurance. Urgent care, $55 copay. which is nice. Unfortunately, out of network is not covered. Outpatient surgery or outpatient mental health, behavioral health, outpatient services. There's going to be a copay for that, which is great. Pregnancy, office visits. It's a good one. And then no charge eyes and glasses. Dental not covered. Again, we have some very good dental vision plans, so I would not let that be a deciding factor down here, unless they need to make sure that it's a zero premium or something like that. We do have some fantastic dental and vision options that I would recommend over that. So here's the classic Silver Next plan. Deductibles close to the out-of-pocket max, which is standard here. So that Ambetter had actually a much better deductible and a much better out-of-pocket max than this plan does. But we do have, this is kind of that hybrid plan where we've got smaller copays for diagnostics, very low generic drug copays, and then we have co-insurance. So in many cases, I'm actually still kind of leaning towards the bronze plan. Now, keep in mind, a lot of this stuff can change based on the subsidy. So I'm pretty sure that's the whole point of this, and why the bronze looks so good is because we're not looking at an adjusted summary benefit. So actually, let's take a look at that. Actually, let's do 20,000. And now let's take a look at the next plan. Yeah, and so this is why they have why that this silver plan is different than their bronze. The bronze actually looks like a better plan at a lower premium than the silver just on the surface if we're looking at strictly full price. However, when it modifies, we've got a zero premium deductible now. We've got a much lower out-of-pocket max. Okay, again, with Oscar, you do not need to get a referral to see a specialist. Same thing with Ambetter, and I believe Bright's the same way. Cigna and Molina, you do need a referral, so keep that in mind. Primary care, much lower. You know, now we can see that this is a far better plan than that bronze version of this. Okay, lower copays for diagnostics, and then right off the bat, because the deductible is zero, we're at 40% right off the bat. So 40% co-insurance with all this, $25 copay on urgent care. So pretty reasonable things here. Very reasonable, actually. And you can see the cost savings here in some of these examples. So again, I'm a big proponent of Oscar in all counties. Now let's get into the most interesting county of them all, Palm Beach. Okay, double check when you're in here that these get checked. For some reason, when you're flipping between carriers, Ambetter does, or sorry, HealthSherpa does not pull that properly. So make sure you're double checking that. Also, another cool thing, they had gotten rid of it, but it's back now, which is fantastic. I think this is a new feature that's they had not used last year. Right off the bat, you can search for a doctor, and it'll modify the results to show you only plans that take that provider. So that's a huge time saver rather than having to go through and click the doctors and search for the doctors on each plan. Now we can go up here and do let's do family medicine. Sonia Smith. Okay. No idea what network she's in. But when we check that box, it's going to show who's available. And it only is Oscar, Melina, and Blue. Better and Bright are out. Okay, so that's a good way to filter out the weeds and really get in there and make sure that that we're making sure that we're providing the getting the right product for or carrier for your client. Let me actually do something else here. I'm going to multitask here. Women's Health Partners. Oh, not South Carolina. We don't want that. Well, one of my agents was curious about this, so I do not see this as an option in Florida. It's kind of strange. We'll have to figure out who the specific doctor is. Anyways, that's a fantastic feature that I think is going to save us a lot of time rather than going and having to search each individual. And it's going to show right here. If you click on this checkbox, it's going to only show plans that include that. But if you leave it unchecked, it will show the ones that do and the ones that don't. Okay, and I'll say that right there. So, one thing that I really love about Palm Beach and the fact that we have so much more competition in the market this year is look at this. We have 4 plans within $4 of one another on bronze. That is just phenomenal. Okay. Again, I'm gonna push Oscar. I think all in all, it provides the best value. Again, it all comes down to network. Okay, you got to make sure all these networks are different. So you've got to make sure that their doctor's in network. So do that first and then see what's left. If Oscar's available, my preference is there. Cigna is also a pretty good plan. I think Oscar's still got a beat on benefits, but it's got the reputation, right? They've been around. You know that they're going to pay their claims properly. I think that peace of not mind of a that name brand it adds value, and I think we should be pulling a lot of business from Blue through Cigna. So if someone's got Blue, I'm pushing Cigna. If someone's got something else or nothing, I'm typically going to be pushing Oscar unless they say, "Oh, I've never heard of Oscar. I want something that I know that's got a good reputation." Cigna is going to be a good one for them. But again, it's going to come down to network. They've got Boca Regional, which is fantastic. None of these other plans have Boca Regional, but it doesn't have the other ones. It doesn't have Del Rey. What's the other one? Maybe JFK is the other one. I'm not sure if that's Boca or if that's Palm Beach uh, or Broward. Might be getting some things confused there. But they do not have Del Rey, and then there's another one that they don't have. I know they don't have West Boca, but they do have Boca Regional. So if you've got clients that use Boca Regional, Cigna is going to be the best option for them. Now, they are going to need to see a specialist or get a referral to see a specialist, which is kind of a bummer. But they're going to be, network, in network, out of network, same for emergency, which is good. And then children's eye exams and glasses. So this is going to be a very basic bronze plan for Cigna. But again, all of those plans within $4 of one another, which is just fantastic. Again, this Molina plan's not a bad one, okay? If you can get that at 0 premium, not a bad plan at all. Again, Bright at 417, and then Oscar and Cigna at 423. So we're within $6 of one another on the silver plans. Again, this is not the year that, like the past couple years, where we just want to throw everyone in the cheapest option. We have 4 quality plans or quality carriers within $6 of one another on the silver plans and within $4 of one another on the bronze plans. Make sure we're looking at network first, and then we're actually getting into the plan design and finding the best fit for them. Just go over this Cigna plan. Okay, lower deductible, standard out of pocket. Copays, they do have telemedicine. All Cigna plans do. Free. Generic drugs, copays, urgent care, $100 copay. Same thing out of network, which is nice. And then 50% coinsurance all the way through. So again, I do still prefer Oscar as far as benefits go. But again, reputation, everyone knows Cigna. Let's be pulling people out of Blue and putting them into Cigna.